Welcome to the Wellness Law Podcast, where wellness and the law meet for contemplation and collaboration. This podcast is brought to you by the Center for Health and Wellness Law. I am your host, Barbara Zabawa. Welcome, Stephen O'Connor, to the Wellness Law Podcast. Everyone, please meet Stephen. He is a staff attorney with the National Health Freedom Coalition, which is based in the Twin Cities. But Stephen, I understand you are in San Francisco.
That's correct.
So tell us a little bit about your background and how you got to the National Health Freedom Coalition. And what is the National Health Freedom Coalition for those listeners who may not have heard of it before?
Okay, well, we have two sister nonprofits. So there's National Health Freedom Coalition is a C3 educational nonprofit, and then National Health Freedom Action is our sister organization. It's a C4, which allows for lobbying and efforts to get legislation passed. And, in the big picture, our missions include, educating Americans about health freedom. And the issue that we spent first bunch of years of our organization on is called Safe Harbor, which is something that you've probably dealt with a lot.
I actually
And
have.
the idea there is that we have a problem, which is the Medical Practice Acts, which say if you give somebody some chicken soup because they tell they might feel better, then you could be practicing medicine. So the idea is to carve out an exception. And so the safe harbor idea is that when it comes to alternative and natural healing modalities that don't have a potential for harm or significant potential for harm, that people should be free to heal each other, and the medical practice shouldn't prevent that. So, for example, one of our founders, Diane Miller, she helped get a safe harbor passed in Minnesota back in 1999. And there were already two states that had some similar protections. And then since 1999, at least another 8 states have passed safe harbor laws. The last one, I believe, was 2019 with Maine.
Mm-hmm.
And so the idea, and again, let me just list off the states to give an idea. We have Maine, Nevada, Colorado, New Mexico, Arizona, Louisiana, Rhode Island, California, Minnesota, Oklahoma, and Idaho that have some version of similar protections. And currently, right now, there are a lot of states that are interested in having this type of law. We're currently working with Massachusetts, Oklahoma, and Florida towards getting something filed in 2026 on the safe harbor aspect. And in throughout, since 1999, and I believe we were incorporated about 2001 as a nonprofit. Since then, we've helped state activists to write and pass some of the safe harbor laws that we passed. And so, as an organization and more of the National Health Freedom Action, we are dedicated to helping state level activists, to coaching and helping draft and we have a lobbying consultant helping to teach folks how to lobby. So kind of boosters and support for states that want to see, for example, safe harbor law passed. Now, two other areas that we work on or that I want to touch on real quick. One is called the right to refuse. And that's something that we started in 2000. And so we've been tracking all the bills around the country that protect your bodily autonomy around things like vaccines and masking. And so since COVID hit, I believe at least 29 states passed about 89 laws, including a few resolutions that are really wide variety of things, such as everything from they can't make you take a COVID vaccine to go to school to blood banks have to record if somebody's received mRNA and label that on the blood, everything in between. And so, with both the safe harbor and the right to refuse, we're looking for activists. So, anybody who wants to see, for example, a safe harbor law in your state if you don't already have one, or if you need a stronger one. We're here to help. And so our model is that you can gather up 3 people who want to be activists, and at least one person willing to take on some leadership responsibilities, and that approach us, commit to helping you, meeting with you every week, studying your state laws and figuring out how, for example, a safe harbor or a right to refuse law could fit into your particular state scheme. Because every state, there's a lot of similarities, but there's also a lot of differences in terms of how the overall statutes and codes are structured. There's a lot of variation.
Yeah. Well, let me just stop and pause right here and make sure that everyone who's listening is on the same page as to what is a safe harbor law. So, correct me if I'm wrong, but my understanding of a safe harbor law is basically carve out an exception in the state statute for unlicensed health practitioners, wellness practitioners to deliver services that might otherwise be construed as, say, the practice of medicine or dietetics or some other licensed health profession. But if you don't have a license to practice medicine or dietetics or any health care profession, but you want to provide, say, nutritional advice or some other type of service that could pass for practicing medicine, you can do that with within the safe harbor law. You can do that, but the safe harbor law will provide some requirements that you have to meet in order to do that without a license. So one of the big things that I think most of the safe harbor laws require is you have to give a certain amount of information to your clients about what you're doing. You have to tell them, I'm not a licensed healthcare provider. You have to tell them about the risks, basically an informed consent, and then maybe some other requirements that you have to meet. But if you meet all those requirements, then you can deliver the wellness services without having a license to practice medicine
Right.
or healthcare.
And that's all correct. And I think one way to think of it is that if you're doing alternative healing, such as herbalism, homeopathy, if you're in a safe harbor state, you can explicitly say that you're offering healing services. For example, with an herbal recommendation,
Mhm.
somebody's got insomnia, and you say how you should try some poppy extract or what have
Mhm.
you.
Mhm.
Whereas in states that don't have a safe harbor law, folks, in that space, I believe this is something I'm not as much of an expert as you are, that they can't in any way uh, communicate that they're going to help with a health problem
Yeah.
or help heal a health problem. It has to be in the, conceptualized as coaching or education. Again, I think more. That's kind of where the rubber hits the road
Yeah.
in most states right now.
Yeah, that's exactly right. I mean, that was the substance of my law review article last year that I wrote defining the field of wellness law and really trying to distinguish between practicing healthcare versus practicing wellness and how the law treats those two things very differently. And where I landed was, healthcare, the laws, the Internal Revenue Code, the FDA being really good examples, look at medical care as something that is treating, curing, preventing, diagnosing disease, illness, injury, and therefore requires a licensed healthcare provider, most likely a physician, to do those things. So if you are a wellness practitioner without a license in a state, you can't treat, cure, diagnose medical conditions like insomnia, I think, is a medical condition, depression, anxiety, lots of things that wellness can alleviate to a degree, but you can't promote yourself as offering to cure or treat or diagnose depression or insomnia or things like that. So, because those are medical conditions, so you have to look at your services in a different way. And where, I love, that, what did you say? There was like 11 states that have these safe harbor laws. So that means the vast majority of states do not have these safe harbor laws. And for a lot of wellness practitioners, they want to practice nationally. They want to use technology that allows them to see people from anywhere, and they can be anywhere when they're doing it. So there's a lot of telehealth and virtual platforms out there that allow them to do that. But that means that, sometimes they may be benefiting from a safe harbor law because their client is located in one of those 11 states. A lot of the time, they're going to have clients that are not in a safe harbor state, and where they have to be very, very careful about what they say and do so that they're not violating that state's medical practices.
Right. And, one of our goal would be to have a safe harbor in every state.
Yeah. Wouldn't that be
So
great?
yeah, so any, consumers, practitioners, concerned citizens that want to see such a law, I put our website on the video here. So you can go to our website and reach out to us. And we would like to see, wherever you have to be, state to help see a safe harbor passed. And
Yeah.
I mentioned before we started that currently Oklahoma, Massachusetts, and Florida are all working towards putting in a safe harbor bill for 2026. And one thing about activism and passing laws is it can take forever.
Mm-hmm.
Sometimes it can be done, in a year, but sometimes people fight year after year and eventually they'll get the result they want. And so the other thing I wanted to touch on is newer in terms of our focus, which is the expanded practice for licensed medical professionals. Is it okay to
Yeah, that's the third area that you guys are working on. What is the Expanded Practice Act that you guys are
right?
promoting?
Basically, in a nutshell, it's kind of a safe harbor for licensed health professionals, which would include doctors, nurses, and in most states, a dozen other professions. And so the issue with the safe harbor, we have all the natural and safe, modalities that are being used, whether it's herbalism, homeopathy, massage, what have you. In the area of medicine, they're, practitioners they're kind of under the thumb of regulatory authorities, state law, federal law, and most states and most circumstances right now, they're bound by mainstream standard of care, which often is defined in a way that's like, well, more doctors say this.
Mhm.
They don't think that your homeopathy has any basis. The expanded practice idea is that as long as what you're doing has a reasonable potential for a therapeutic benefit, and you give full disclosures that you're operating outside of the mainstream, theoretical bases, and these are your own theoretical bases. So there's safety guidelines and also disclosures that are required. Now, this basically we revised a model we had done for this year, so we're calling it our expanded practice for 2025. And just really quickly, in terms of the history, since 1998, states have been trying to give doctors and other licensed health professionals more leeway to use alternative care. And so New York was the first to pass a law, trying to allow that. And from that all the way through till today, different states have passed different attempts to allow doctors to use alternative medicine. But the way they've all been written, except for Utah, they've all been written in a way where you're still stuck within the standard of care. So you can use an alternative, but we're going to still take you to the board and bring in 10 mainstream, doctors who are going to say that you're wrong and this and that. And so Utah, I believe in 2023, passed something that allows doctors to explicitly go outside of the standard of care. And so really briefly, what our Expanded Practice Act would do is that under the conditions that you have a reasonable basis for a potential benefit and the service doesn't pose a greater risk of harm than what would traditionally be used, and you give disclosures, then a doctor can step outside of the standard of care. And some key points to the model are that the regulatory authority would have the burden of proof that the professional was acting outside of the expanded practice. And also, we put in the bill that licensing boards are required to use at least some experts, not just in the field of medicine, but in the specific expanded practices.
When they're assessing the potential for harm?
Well, if someone, that would be one part of it, but also if they're saying that, well, there's no scientific basis for this, then they also have to hear from an expert who is practicing in that, what I'll call alternative or expanded modality. So, for example, if someone was, legally arraigned for using homeopathy, then they would be allowed to use, the board would be required to hear from experts in homeopathy, not just experts who want, you know, say that homeopathy is bad or something. So this is another bill that we'd really like to see, all over the USA. So along with our other focal points that we talked about, anybody who wants to see such a law passed in their state, I'd really encourage you to reach out to us and we'll have an exploratory conversation what we might be able to do to help.
Yeah. Well, I'll make sure that I put in the description your website, nationalhealthfreedom.org, so people can connect with you, learn, keep up to date on what your initiatives are, and if they want to get involved, that they know a way to get involved. One
Right.
thing that I want to just go back to is the opposition to these bills, the Safe Harbor Model Act for expanded practice, right to refuse. So for anyone who might be interested in advocacy on these issues, who are the typical opponents and why are they opposed to these bills? Because I know you guys have been working furiously in all kinds of states trying to pass these bills year after year. As you say, it's a long slog. And that means that the bills that you're trying to put forward have a lot of opposition. So could you tell us briefly, like, who is opposing and why?
Yeah, I mean, the safe harbor, the biggest opposition is a combination of the mainstream medical community of doctors, medical boards. And on the one hand, many people have safety concerns and think everything needs to be highly regulated. And then there's the frank reality that when you have a monopoly, when you have the state excluding your competitors, who would want to give that up? It's that kind of monopoly power.
But are they really competitors? That for me is the big question. So if it's the medical community and like the medical societies and the medical boards and the state, I don't know, is the AMA included in that as well? The
Well,
American
they're the head of the whatever it is.
Yeah, so if we're talking about wellness practices, trying to spend time with people who want more information, more options, more knowledge about alternatives, about ways to improve their well-being. If that's really what a lot of these safe harbor bills are trying to protect, is that kind of service. When does the medical community ever have time or incentive to engage in those lengthy conversations with their patients about alternatives and options and ways to improve their well-being? I mean, honestly, let's really look hard at how medicine is practiced. And I'm not blaming the doctors one bit. They are victims for the most part in this big conventional healthcare system. that we have in the US. But, I mean, is it really competing with them? I mean, because if there's not these wellness practitioners out there offering these services that really take the time to listen to people and try to understand how they want to improve their life and ways that they can improve their life and the myriad of ways that wellness offers that, are they really gonna be able to get that with their
Right. I
primary
mean,
care doc?
and I mean, at some level, from their perspective, if you use alternative and natural methods to prevent or get out of being sick, then they've lost business. You know?
Okay, so
So,
you're looking at from, "We want you to be sick, we don't want you to get better," kind of, that
well, one thing that occurred to me today is just the difference between the 20th century and the 21st century. Because the 20th century was really the century of industrial medicine, better living through chemistry, the imposition of all the medical practice acts in the very early 20th century. A lot of people throw out the term Rockefeller medicine, but the idea of, and it's often been the case throughout history that the alternative healers or the natural healers are there are more women. And then you have traditionally the medical establishment being more male.
Mhm.
And so it's kind of this scientism and industrialism kind of coming down on the natural and the alternative. So I think the 20th century was kind of, I'm hoping the high point of all that. And since then, we've seen in the last 20 years, a lot of states have passed a safe harbor. Americans are becoming much more, I believe, educated and knowledgeable about the fact that the food that they're selling us, the medicine that they're giving us, is often not great. And so, I mean, when it comes to engineering, I think allopathic medicine is great, right? If you have a broken bone, they know how to do engineering. But yeah, as you said, if we're talking about wellness, they don't have the training, they don't have the time, et
Or the
cetera.
incentive, the financial incentive. I mean, the
Well,
system is not set up to reimburse and
right.
financially reward practitioners to spend time and actually improve the well-being of the patients. I mean, trying with these value-based payment initiatives, but, at the end of the day, that's slow going and, there's a lot of it's not leading, there's still a lot of disgruntled patients out there who feel like their needs are being ignored, especially marginalized communities. And so I just question the whole idea of worried about competition. I don't see them as competing. If anything, they complement one another, the wellness and the healthcare, at least as it's currently set up.
Right. And the Maha movement going on. And,
Mhm.
our groups are completely nonpartisan when it comes to politics, and elections, and what have you. But, everyone in the health freedom movement was pretty excited about RFK Jr. being appointed. And from my own, individual point of view, it seems that they've kind of put him in a steel cage of people, to prevent him from doing that much. But, it is, I think Maha is a ray of light and a symbol of, that Americans want to get healthy, that Americans want to, step outside of these paradigms that have left them sick, to basically, eat whatever's at the grocery and
Mhm.
take whatever the doctor gives you, taking your own health into your hands. And so, as I said, I think I'm hopeful that this century that we're already a quarter through, which kind of surprises me.
Wow, you
Time's going
said
right.
that, and that just hit me really hard.
Yeah, well, this in this new century, in my opinion, we're seeing a lot more in the health freedom. And the last century was really the shutdown of health freedom. If we look at 1900 to 2000,
Yeah, they're definitely different dynamics, and
right?
both have their place. Of course, we want scientific, evidence-based, medicine. I mean, there's a lot of good comes from that. But we also have to acknowledge that the current health system is not meeting the needs for so many people, marginalized communities, and even, mainstream or, majority patients feel like, they're not getting all the attention that they need.
Right.
Even if they have insurance and they have access to really good health care, there's still,
Right. And
still,
one thing I want to know more about that I think that you're the expert on is, so if we're in a safe harbor state, you can explicitly, heal people. Whereas if you're not in a safe harbor state, people tend to practice, using designations such as a coach.
Mhm.
So, since that's really your area of law, in a nutshell, what's the difference?
Yeah, well, as I have told people in my presentations and in my writings, I think, obviously there's no black and white. There's a spectrum of risk. There's more risky and less risky things you can do as an unlicensed wellness practitioner. And if you're unlicensed and in a state that isn't a safe harbor state, or your client is in a state that's not a safe harbor state, the best thing that you can do is look at your clients as wanting to be empowered. And so, I caution against wellness practitioners, even if they're in a safe harbor state, frankly, to avoid trying to help vulnerable people, vulnerable patients, people who are suffering from cancer or some really debilitating disease. And the reason why they're seeking your help is to cure or treat that debilitating disease. I think that's a recipe for big legal risk. It's one thing to be an adjunct to a licensed healthcare provider who's treating the cancer, who's treating the whatever ailment, and you're kind of supplementing with trying to improve, the chances that whatever the treatment is will work or whatever. But if you're a substitute for an oncologist, if you're viewing yourself as a substitute for oncology, I think that could get you into a lot more legal trouble than if you viewed yourself as trying to empower your client with information, with knowledge and tools and resources to help them feel better, to help them improve. So I don't look at it as healing, or I try and have my clients not look at it as healing, but more, looking to improve the status quo, whatever that
Right.
is.
I
So you're
like the
empowering
empowerment
them.
is a good word.
What was that?
Empowerment, that's a good word.
Yeah. And that's really the demarcation for me between healthcare and wellness. Healthcare treats the vulnerable, and wellness empowers the client. And if you look at it that way, I think you'll get on the right track. So that's what I encourage wellness practitioners to do. So, great question. And I think we're kind of out of time. So I really want
Okay.
to thank you, Stephen, for all of your insight and your work with the National Health Freedom Coalition. And I will make sure people know to visit your website, nationalhealthfreedom.org, if they want to get involved in their state and try to pass laws that are more friendly to the wellness community.
Excellent. It's really great to talk to you, and I wish you a great rest of the day. And you're a wonderful resource. I'll be in touch.
Oh, thank you, Stephen.
Thank you for listening to the Wellness Law Podcast. You can find more wellness law resources by visiting the Center for Health and Wellness Law website at www.wellnesslaw.com, where you can also subscribe to our newsletter and follow us on social media. Until the next episode, stay well, stay hopeful, and stay legal.